a real conversation, tearful conversation with a patient I had just recently. There was a mom, children, has got parents they're taking care of and all these things. And she came in, she just said, I'm wiped out. She's distraught. She was tearful. She obviously had been having some tough times recently. She said that, my kids need me, my husband needs me, my parents, they're getting aged, so I'm taking care of them. I've just been running around doing, she'd start talking about all the activities she was doing, involved in different athletics for her kids and just giving of her time in every aspect of her life. And she stopped and she started tearing up and she said, I'm just wiped out. I can't do it anymore. I feel like I have no energy. I'm just so tired. And she said, but every time I go in, I have my labs done. I go into my medical doctor and I tell them something's not right. I can't do it anymore. And they do their labs and they say, well, everything's fine. Everything's fine. We'll see you another 6 months. They just tell her that everything's normal, that it's all good. Well, she said, I just know there's something not right with me. Something's wrong. I don't know what's wrong, but something's wrong. I can't do it like I used to. And I said, well, there is something wrong. You know there's something wrong. I know there's something wrong. But it's just not being found. There's got to be something else that's going on. And the frustrating thing is when you go in, you have these labs tested and you've seen seeing a provider for a period of time and nothing is found, then it makes you feel like you're crazy. And that's not good, right? So this is the point, is that if you keep going in, you have your labs done, and you're going in and they keep saying that everything's normal, then there's one of two things are probably going on. Number one, your provider, they're just not listening to you. They're just not listening. Or number two, they have nothing else to really offer you. Now, that's not necessarily mean that they're a bad person or anything, but either they're not listening or they have nothing else to offer. And that's important. If you don't want to keep banging your head against the wall, you've got to get to the root cause of what's going on. That might be looking at your adrenal function or your immune system issues, or perhaps looking at gut dysbiosis, or heck, how about even checking your neurotransmitters and measuring those? But there is a cause. In this case here with this young lady, I said, you've got to look at the reason why your body cannot keep up anymore. It was previously, and now it's not, to be quite frank here. Your immune system and also your adrenal system is just shot. It's just wore out. It's kind of the tired horse analogy. You've got to support that horse or take the stresses off of it. And maybe there are some emotional stresses, but you've got to get to the root cause. And you've got to support that body so it can do the job like it used to. But if somebody's not listening, they're not listening. They keep finding everything the same. They're not listening. Or perhaps there's nothing else they have to offer. Then what you have to do is you need to find a different provider. Or you need to try to get them to listen in a different way. Sometimes people just don't listen because they've just been hearing the same thing. They're not really listening. So one of those two things. But just don't give up. There's something wrong. I know there's something wrong. Get to the root cause. Check us out on Facebook, on YouTube, and check out our live streams Thursday at 7 p.m. Any way we can help you out, let us know. Murray Natural Integrated Health, setting the standard in natural health care.